Doctors say diabetes has reached epidemic proportions on the south side of Chicago. About 20% of African Americans in the city have the disease, one of the nation's biggest killers. Many don't even know it, but there is encouraging news. A simple program created by a Chicago doctor is helping to reverse this dangerous trend. Barbara Pinto has the story.
On Saturdays at Save-A-Lot stores on Chicago's South Side, the supermarket doubles as a classroom.
1 gram or one serving of a carb is 15 grams, okay?
The teachers are doctors and nutritionists. The students, all suffering from diabetes or at risk for the dangerous disease, including Jeanette Bowen of Englewood. At age 60, she is learning for the first time that the food she grew up on and loves can harm her health.
I didn't know that leaner was better, and less sugar was better. But I've learned that now, especially now that it has a lot to do with my weight and my health.
I cannot tell you how important it is to get to know your vegetables. They are your friends. They are your buddies.
The idea here is lifestyle change, chipping away at old unhealthy habits.
If you are still frying your food, you are compromising your health.
In the war on diabetes, the insidious and in many cases preventable disease elevates blood sugar, putting patients at higher risk for heart attack, stroke, kidney failure, blindness, and a long list of serious and potentially deadly complications. African Americans are at significantly higher risk, making Chicago's South Side ground zero. 1 in every 5 South Side residents has diabetes. In the rest of the city, it's 1 in 14.
But maybe try the Glucerna first and see how you like that.
Dr. Monica Peak, an internist and researcher at University of Chicago, runs the Southside Diabetes Project.
It's an epidemic. It's a problem that is taking over our country. It's being chased by the obesity epidemic. So the heavier our country gets, the more increased risk we are for seeing the onset of type 2 diabetes.
The program operates 6 clinics, 2 on the University of Chicago campus. The holistic approach to prevention and treatment addresses the medical, cultural, and economic issues that put Southside residents at higher risk.
Because the cup is so big, it's going to take me a little longer to inflate it, but we're almost there.
Patients start with an exam and an unusual prescription for fruits, vegetables, lean meats, and low-fat dairy. Dr. Peak says there is something psychologically compelling about seeing it written on a prescription pad.
We normally don't think about food and exercise in the same way that we do about medications. So just making that mental shift to this is as important as taking my medication every day.
The need is overwhelming. According to the Centers for Disease Control, an estimated 29 million Americans have the disease, but 1 in 4 don't even know it because they haven't been tested. And more children and teens are at risk for a number of reasons, including sedentary lifestyles, supersized portions, and diets rich in fast and processed foods full of sugar, salt, and fat.
The problem is especially severe in economically challenged neighborhoods where fresh food and produce can be tough to find.
For people who lived in a food desert, they were more likely to be obese and more likely to have type 2 diabetes and other chronic health conditions. And so we do have some evidence that it's not just how you live, but where you live that can affect your health.
So participants are given coupons for cash off at local Walgreens that stock produce and at supermarkets and farmers markets. They also get classes, supermarket tours, one-on-one support, and advice that Dr. Peak is careful not to call a diet.
We're really trying to say is that this is a lifestyle change, that everyone should eat like they have diabetes to avoid having diabetes, eat like a diabetic to avoid becoming one.
In this case, a pill is not the answer. Studies show that lifestyle change is twice as effective as medication when it comes to preventing diabetes. Jeanette Bowen is prime example. Her father, 4 of her brothers, and her son had diabetes. Her health was failing too. After getting a prescription from Dr. Peak, Jeanette traded pork and beef for chicken and turkey and gave up pizza, macaroni and cheese, and ice cream.
I've lost 25 pounds. I had to make a life change because I was a pre-diabetic, which now I'm no longer a pre-diabetic.
When we stopped by, Jeanette was cooking chicken.
I put some flour on that chicken and fry it up. and some oil and make me some French fries. That's what I would have done before I made this change.
The new Jeanette uses olive oil spray and a lot more vegetables.
I've enjoyed all this good food for 60 years. It's time now to enjoy what's best for myself and my body.
Doctors have been telling patients to eat better for years, but participants say what makes this successful are the close relationships with healthcare providers and the classes that generate community and empowerment.
I'm afraid that I won't be around to see my grandchildren grow, which I love my grandkids very much. And they love their Nana very much, so that's my biggest motivation.
The prescription for food as medicine, Jeanette says, was the start of her cure. For In the Loop, I'm Barbara Pinto in Chicago.
The National Institutes of Health is funding a study of the Southside Diabetes Project, hoping to learn more about treatment and prevention in high-risk communities. Now joining me is Dr. Elbert Wong, Associate Professor of Medicine at the University of Chicago, and welcome. Thank you, Chris. So an astounding number, 1 in 5 African Americans in Chicago. What accounts for that discrepancy between African Americans, other minorities, and the Caucasian population?
So it's a mixture of probably genetic differences between the racial groups. So we know that African Americans, Latinos, and actually Asians like myself also have much higher rates of diabetes than Caucasians. So it's partially genetic, but the other component is probably differences in culture and lifestyle and the foods we eat, the lives we live. All of that contributes to racial differences.
Can you say which of those is the primary factor? Is it genetics or is it environment?
Well, I think the racial differences are explained by genetic differences, but the trends that we've seen in skyrocketing rates of diabetes prevalence are due to changes in lifestyle that all of us have taken on. We're eating worse food, we're having more sedentary jobs, sedentary lifestyles. I think that explains the dramatic rise in diabetes over the last 30 years.
What is the human toll when you're talking about the associated problems that come with diabetes?
Well, on a human level, for individual patients and their families, it's huge. It's the leading cause, one of the leading causes of blindness, kidney failure, amputations. It's a major cause of heart disease and stroke. So on an individual human level, it is a massive toll. In terms of dollars, we spend about $250 billion a year on diabetes. That's both in terms of the cost of care, everyday prescription drugs, hospitalizations, but it also accounts for lost productivity, losing your job, going on disability. All of that is part of the cost of diabetes.
We're sort of inundated now with commercials about diabetes. The pharmaceutical industry, of course, sees a big marketplace here, but when it comes to preventing and treating diabetes, is it a matter of finding the right drugs, or is it a matter of the lifestyle changes that Barbara Pinto was reporting on in the opening segment?
There is no question. We now know for certain that we can prevent diabetes. So from landmark clinical trials that were done in the early 2000s, both in the United States, Finland, and China, we know that a healthy lifestyle, it's about 150 minutes of brisk walking a week, trying to lose about 7% of your weight if you have prediabetes, that can cut the rate of developing diabetes by half. And it did better than the drug arm of the trial, at least during the course of the trial. So we know that that can work, and we know that people who went on another NIH-funded trial that involved the same lifestyle changes, they can come off of some of them can come off of medicines and control their diabetes. So a lifestyle is what we emphasize for all patients, and it should be a part of everybody. Everybody who has a risk or has the disease, a healthy lifestyle is the core.
We all know that knowledge doesn't necessarily translate into behavior. People may know what's good for them, but they have these habits that die hard. How do you change that?
Oh, that is a big focus of a lot of people who, especially people who have from the field of behavioral economics, where we're trying to come up with ways to make it easier for people to make the right choices. That has to some extent worked, but we need to change the structure around people's lives. So that's why things like changing the built environment, changing the cafeteria in schools, making it easier for people to make the right choices can be facilitated by policy and the workplace.
You're part of this team at the University of Chicago. We saw the writing the prescriptions for healthy food. Is that a gimmick, or is that something that actually can make a difference?
There's actually empiric proof that telling a patient to exercise on a prescription rather than verbally actually produces higher rates of adoption of exercise. And so we also know that writing the Food RX, we believe, can also do the same thing. And so the authority of the doctor still has some role here.
That's good to know. Dr. Albert Wong, thank you so much for joining us. We appreciate it.